Maybe. It's pending. Okay, there we go. Okay, so then with our emails, with it transferring to Outlook, sometimes it doesn't want to load right, but sometimes there will be a blue like link at the top that says like trust this email or put on the safe senders list or whatever. But if it doesn't let you do that, there's three dots at the top of an email. You can click add to safe senders and it should allow all of our content to go there. And then it should also probably go to our like focused inbox, not the other one. If our emails are going to your other inbox and you'd like to change that or for any of your senders, at the top of an email from whatever address, you can click like move all of ESW Akron's emails to the focused inbox, and then it'll go there from now on. And then as a quick side note is on our on a mobile device, our emails might not load correctly with some of the colors of the text and stuff. Just a heads up. And then Slack. Is anybody here not on Slack? And would like to be on Slack. Slack is what we use as just like a quick reminder. Like I just sent out, hey, don't forget our meeting is right now, or whenever you're on a project team, that's the main way that you can quickly talk to people. It's kind of like Discord where there's different channels. So if you're interested in joining Slack, there's a link on our website and in all of our emails, and you can also reach out to any of the officers or to our ESW Akron email and we will assist you. And as another quick side note is our t-shirts are $12, and if you'd like them, then you can follow this link. There's also a link. I'm going to put it in all of our emails and it's on the website. You can also email us. And if you'd like to start working on a new t-shirt design, then just reach out to us. So we're going to start going over our project teams. We have a couple. I'm the education team leader. We work on environmental and sustainability topics that you're passionate about. Brooklyn's done a independent project. Another officer has done an independent project than I have. But right now we're going to work on educational resources to like take the place of field trips from COVID-19. So my mom's a kindergarten teacher, so I'm really excited. We're going to do a presentation for Earth Day for her, I think. So that's what we'll be working on this semester. And you can work as much or as little as you'd like and only about topics that you care about, because, you know, the more passionate you are about something, usually the better presentation. So let me know if you would like to join, and I can help you get in the right Slack and get on my email list and all that fun stuff. And there's my email, and I will be posting the when to meets in the chat. Since I'm sharing my screen, I'm not really sure. I'll post them once I'm done sharing my screen. And then we'll figure out a time and date to meet, as with all the other teams. So Nor isn't here, so I will also present hers. ZPP, which is Zips Precious Plastics, is another project team that we have here. We're working toward a single-use plastic workshop where we'll shred down like used plastic water bottles and then like melt them down and then make them into like useful objects. So if you see in this picture, there's like clipboards, and you can make like water bottles and silverware and all this stuff. So our end goal is to do that, and we're working towards that. So if you are interested in joining that or learning more, then you can email Nor. Her email is on the screen, and all of our officer emails are at the bottom of the regular emails. Or you can reach out to us on our website, using our email, all that fun stuff. Bike Power. Neither of our Bike Power chairs are here either. So, Bike Power is getting a revamp. So we have two leaders. We have Anna and Megan. Their emails are below. So the goal of Bike Power is to use the mechanical energy from the like somebody riding a bike to add like safety lights and a phone charger, speaker, anything that you can think of that would be helpful for like when you're riding a bike or for safety features and all that. So they're working on that, and I believe they're getting a design in the works this semester, and I think Michaela had ordered parts before.
Yeah, when I last spoke with them, the plan was, assuming that at some point we'll be able to start working in person again, they were hoping to get like at least one bike kind of setup done by the end of the semester so that in May we could do a ESW bike ride. And we could kind of take turns riding like the bike with the phone charger. And we could do like the bike share through the rec center. So keep keep posted for updates on that. We're hoping that that'll be a fun thing to do at the end.
Yeah. And then now I will let Jacob present his new wind turbine project.
Hey, so this is a new project. We are working on pretty much creating a wind turbine from scratch. So like the blades, the generator, the charge controller, battery. We're going to be purchasing all that stuff and making it. We're recruiting new members. Since it's a new project, I've had a couple people email me, but we don't have very many members. It's in the design and proposal phase. We're waiting to hear back about the funding for it later this month, I think. And we're trying to get a design made this semester. So yeah, you can email me if you have any questions or want to be a part of it.
Awesome. And once again, all of our emails and project team leaders are listed in every one of our emails. So you can always join whenever, halfway through the semester, with 1 week left of the semester, right now, anytime. Don't hesitate to reach out. No, it doesn't work. Okay, so I will post these when to meet in the chat because I'm pretty sure you guys can't just click on them. But ZPP has determined that they will be meeting on Thursdays from 5 to 6 on Microsoft Teams, and they will be meeting in their own chat of Microsoft Teams. So the way that you join this meeting today, you just go, instead of to general, you go to ZPP, and that'll be how you get there. We have some other opportunities coming up. We're going to have a hot cocoa, hot chocolate party on January 22nd, so next Friday. And we are working on a time, so we will post that when to meet in the chat. The reason we do when to meet is because we are here to hopefully have as many people as involved as possible and who want to be involved. So this way, if there's a 1 hour block when 7 people are able to make it versus we were gonna have it at like 3 and only 2 people can make it, that way we can have all those extra people able to make it. So that's why we do the when to meet, and this will also be on Teams. Bring your friends, anybody's able to join, and we could play a game, Kahoot, Among Us. So if you fill out the when to meet and would like to come, feel free to shoot us a Slack or an email of what you'd like to do. Otherwise, we'll just have a nice fun chat. You can bring hot chocolate, tea, coffee, whatever your drink preference is. And then we will be making Valentines for Akron Children's Hospital. Hopefully we can have this in person, and that date and time will be determined at a later date, but we'll be making Valentines with DIY recycled paper, and we will be posting about it more on Slack, and it will be in our emails. So let us know if you're interested.
And with that event, that'll kind of be twofold. So we'll have to have an event where we make the recycled paper, and then we'll also have the event where we make the Valentines. So if you are interested in just like one of those things, shoot me a message in Slack, and kind of like what your availability is, and that'll help us better plan for when we want to host these.
Yeah. And that kind of goes for everything, is if you're interested in doing something and maybe your times just don't line up, just shoot whoever's in charge, or you can always shoot Michaela or I an email or a Slack, and we will work something out. So another announcement is ESW Con. There's a national ESW conference every other year, I think. And so you can hear about sustainability topics from professionals and network and stuff. So registration is $40, but we have determined that there will be some scholarships available. So if you are interested in going, this will be a virtual conference during the week of Earth Week. I believe it's the 22nd and 24th. We will put more information out in an email, and let us know if you'd like to go, and we will work out a scholarship maybe. And then we have a mentorship program. There's a link at the very bottom of all of our emails if you would like to talk to one of the officers about anything. Times are tough, so if you want to talk about classes or your plans, or something's just going on, you just need a friend to talk to, then you can always fill that out, or once again shoot us a text or a Slack or an email, and we will meet with you. And then our next general body meetings are every 3 weeks, always on Wednesdays at 5:15. So there's some fun topics that we'll be talking about, and they're also on our website and in all of our emails. And Michaela, have we heard from Dr. O'Sullivan?
Yep, I have him on Google Meet. So if you want to stop sharing, I will start sharing, and hopefully this will work out.
Well, let's try it.
Okay. So I am sharing my screen. Okay. My MacBook is working really hard, guys. I'm running like Google Meet and Microsoft Teams at the same time. Okay. Can you see Google Meet?
We can.
You can. Do you see Dr. O'Sullivan?
We do.
All right. So Dr. Sullivan, I just muted myself. Dr. O'Sullivan, you are muted, but whenever you are ready, I think this will work. And on those of you on the team side, if you cannot hear him, just let me know.
Can you hear me?
Are you able to make your volume louder, Michaela?
Did that work?
How about now? Can you hear me now?
Yep, that's awesome.
Oh, you can. Okay, cool. So I guess the question is, how do I share? Let's see.
If you scroll near the bottom of your screen, there should be near the bottom right-hand corner, there's a button that says Present Now.
Okay. Let's see if that works out. Well, it's not seeming to show. All right, well, let's try this. Hang on one sec. I guess I'll just try to do the entire screen and just blow this thing up. All right, give me 1 second here. All right, it's not letting me share my screen. One more time.
When you click present screen, I think you have to select which screen you want to present. So
yeah, it's just it gets to a pull down menu, but my presentation is not on the list of options.
If you just click your current screen, and then if you open up your presentation, it should should work.
When you say click my current screen, you're talking about the screen, or the presentation screen, or the Outlook screen?
There should be one. Oh, I see what you're saying. Yeah, if you go to your entire screen and then you open your presentation, I believe it will automatically share it.
Okay, let's try that. And then 1 second. Come on, where the heck are you? Sorry, they changed Keynote on me here since I used Outlast. Where are you here? Sorry, I had this down. So all you can see is me right now, right?
Correct.
Okay, so I am on my presentation, clicked on that, but doesn't seem to be doing anything.
We can also just send the presentation out afterwards if that would suffice.
Okay, yeah, it's a lot more boring than watching me, but I don't know why that doesn't work. Huh. That's bizarre. Well, let me just try one thing here. All right, hang on 1 second. I think I need to do system preferences, and sorry to waste everybody's time here, but no. All right, that may not work. Well, dang, had some good slides too. I will, I guess I will send that to everybody, although I'll convert it to PowerPoint for that. So, all right, well, let's just go with what we have, and maybe we can get some Q&A going. But assuming I couldn't actually open the flyer for this, but I believe that I am talking about the combination of COVID-19 and climate change. So let's go with that. So basically, my background actually combines both of those areas for the last 25 years for the pandemic study of pandemics, and then about 15 years or so for the study of climate change, and that's a big part of what I do, what I research, what I teach about these days. And so these two factors are for anyone who knows anything about both of them, go together intuitively. There's no question that these are attached. These are related to one another. And I just want to touch on some of those as in the next 20 minutes, 25 minutes or so. And some of them are more obvious than others, but the ultimate fact is that the COVID outbreak, the COVID pandemic, which is the worst in about 100 years for the world since the 1918 pandemic, flu pandemic, has pointed out everything that everybody in public health and everything that everybody in the study of climate has been pointing out for decades. The first point I would make that is probably obvious to most of you by now, I'm sure you've heard it, is that this was not unexpected. This was in fact very much expected by public health experts. I actually, ironically, I'm not teaching about it this semester at the University of New Hampshire, but I would be in both a global public health class and an environmental security class. So those of us who study this area saw this coming. We knew there was going to be a pandemic. The details of how bad it was going to be were the only thing that was up in the air, and it was either going to be caused by a novel strain of influenza, something that was unfamiliar to humans, that also emerged from probably birds from nature, or virus X, as they call it. So basically a non-flu virus that emerged from nature. And we had already seen examples of this virus X in the previous SARS epidemic. The SARS 1 back in 2003 was kind of a shot across the bow. That also emerged from nature unexpectedly, and there was no cure, no vaccine, etc. And then there have been a number of others, including 2 other cousins to our current COVID. And but the bottom line was that something was going to happen. And one of the first things, and I just give you this brief overview elevator pitch. One of the reasons was because the very things that make us successful as a society, global trade, and the intermixing of people, travel, tourism, the list goes on and on and on. The very things that make us in the 20th century, or at least make most of us, and that even included many of those in poor countries, were elevated at least somewhat by the way the system was set up, the global trade system. But the very structure of that system, the very elements of what made it most successful, also made us most vulnerable to pandemics. Even though tremendous advances in medicine and technology, which we are currently seeing, by the way, and the fact that these vaccines were able to be developed and be so successful, even though sadly the distribution and the manufacture have been less successful. But nonetheless, trade, travel, to some extent, some other factors, migration, and obviously tourism and those types of things are essentially what allowed this virus to make such a quick and continue to some extent to make such a quick travel around the world. So the very core of our success was the very Achilles heel, basically, of our current system. And as I say, most people who study this knew that this was coming because of that, because of the fact you can be anywhere in the world pretty much in 24 hours, even most exotic places in the farthest reaches in probably 36 hours or thereabouts. And so it was going to happen. And even though we kind of had an arrogance about our ability to deal with anything, the fact of the matter was that, as we saw, that this type of a virus, and this is a particularly wily virus, there's no question. This has shocked many people in the medical field in terms of how well it spreads, what it does to people. We're still finding that out, obviously. In many ways, it's worse than a flu outbreak because flu is much more finite. Even a novel flu virus is much more finite in terms of what it does to human systems. And so the medical response to this has been far more complicated and in a variety of ways. But the bottom line was we saw this coming, and those who also studied climate change also realized that we were more vulnerable because of climate change. And so let me talk about that. So some of the most obvious way, and let me just add, by the way, for anybody who doesn't or who knows about the Green New Deal, or if you hadn't, the idea of the Green New Deal combines economic factors, social justice factors, with climate and health-related issues. Basically, it presumes that if people are more prosperous and that they are more prosperous because of efforts to tackle climate change, that we will be better off in every possible way, and that also includes our epidemiological threats, our epidemiological vulnerability to things like pandemic flu and things like the coronavirus pandemic. So what are some of these variables? What are some of these connections? One of the most obvious is that fossil fuel pollution changes the climate, and in changing the climate, changes the public health impacts of a lot of different things. And so, among other things, there's evidence that or not direct evidence that climate change contributed specifically to COVID, but development, human development, certainly, almost certainly contributed to it, as it contributed to previous viral outbreaks, because people are essentially pushing up into the wild areas in the world, right, into the rainforest and so forth. And in some of these places, these viruses have probably existed for millennia, in particular in the case of coronaviruses in bats, which, by the way, harbor 70,000 different coronaviruses. So if you're wondering, could there be another COVID after this one? Most certainly there could, because there are so many candidates that could make the leap from bats to humans. And so just development in general, the expansion of human population, the increase in our demand for food and and land and development and just all of it has essentially contributed to our vulnerability to these novel viruses, these novel diseases. But in addition to that, fossil fuel pollution contributes to people living with poor air quality, and particularly those in the most vulnerable areas, people in developing countries, people in polluted cities, homeless people, poor people, people with crowded conditions, people lacking air filtration, people with compromised health. You see where this is going, and so forth, are more likely to die from COVID, just as the fact that, as noted, or as I said before, that people exposed to air pollution are more vulnerable to it in general. Now, what are the effects of climate change, right? One of the effects is to cause wildfires. Wildfires, particularly in places like the West Coast and Midwest, Australia, and places around the world that often that had not previously experienced wildfires, even in the Arctic and in the tundra in Siberia and places like that, are getting wildfires well beyond the recent many thousands of years in terms of precedent. So just simply air pollution makes people more vulnerable to COVID, and this has been demonstrated in the research. Because COVID is a respiratory disease, though not only, unfortunately, but one of its primary symptoms is respiratory, and it invades the respiratory system. And so if you are exposed to air pollution particulates or you smoke, you are automatically more likely to be infected and more likely to get a severe case of COVID. But as you can see, as I say, where this is going, a la the Green New Deal, those who are poor and are more poorly resourced or have less access to good nutrition or food in general, food deprived, food challenged, and those who have less access to healthcare. This is obviously where the Medicare for All comes in as well, which is part of the Green New Deal. Those people are also more likely to bear the brunt of COVID. And we've seen that again and again. People, African Americans, people of color, particularly correlated with poverty levels, but also there are some genetic components to this for everyone, including for people of color. But people who are poor often have these metabolic diseases, diabetes, heart disease, respiratory syndromes, and so forth, all of which are correlated with much more poor outcomes from COVID, and the death rate among those people, in combination with other risk factors, in particular age and to some extent genetics, and the list goes on, are the reason that systemic inequalities in communities of color and anywhere in the country are contributing, anywhere in the world, have been contributing to a higher risk of getting COVID or contracting severe illness. So on top of that, needless to say, one of the effects of climate change as well is the increase in natural disasters, particularly weather disasters. And so that also makes people more susceptible, because people who are subject to major natural disasters are, for the most part, unless they're very well off, subject to being in crowded refugee camps, for instance. Go back to the wildfires in California and the hurricanes that we saw, and the other storms that we saw actually this year. By the way, this year was a record year for the number of billion-dollar weather disasters in this country. And in most of those, there was some kind of element of refugees having to move from one place or the other because they lost their housing or they had to evacuate to get out of harm's way, et cetera, et cetera. And all of those people had to find places to live temporarily. And in most cases, they were crowded in shelters or in hotels, and on top of that, stressed by the disaster itself. As we know, sleep loss also contributes to this. Stress also contributes to susceptibility to COVID and to severe illness and so forth. So, and ultimately, COVID has affected the planning and preparation for these disasters, as well as recovery efforts, but also has strained the medical systems so that they have difficulty dealing with these other issues as well as the COVID outbreak. And one of the other things, by the way, that I wish I could show you is this disease triangle. This is a sort of a standard graphic in public health that looks at what makes a severe disease outbreak. Obviously, the pathogen itself, the organism, COVID, is as I say, wily in many, many ways, doesn't necessarily have a high mortality rate, a high death rate, but it's certainly high enough to have killed many, many hundreds of thousands of people around the world. So you've got the factors related to the disease and how it spreads, what's its ideal conditions for spreading, how bad is it going to cause it, or how bad is the disease that it's going to cause. But then, in addition to that, you've also got the environmental conditions. Cue the term environmental, right? And those environmental conditions relate directly to whether the pathogen can spread easily. Sometimes in the case of, for instance, HIV, it's strictly human to human, right? There's no airborne transmission of some diseases like HIV. Others like flu and like COVID very much are predominantly aerosol and or just airborne in some way, either droplets, larger particulates, or smaller particulates, or both, and so forth and so on. So each disease has its own personality and obviously its own sort of way of getting to people to infect them. And all of the things that climate change causes in some ways advantage COVID and other infectious diseases, including waterborne diseases, cholera and dysentery and so forth. And the list goes on, because when people are stressed and are forced into stressful environmental conditions, then their other susceptibilities can really kick in. And so you've got the disease itself and its characteristics, the environmental conditions, both for the disease organism and for people. And then on top of that, the third part of the triangle is people's unique susceptibility. And that includes the things I mentioned before, things like nutrition and genetics and race, ethnicity and gender and pre-existing conditions, various disease pre-existing conditions, but also hygiene. As we know, one of the fundamental aspects of COVID is practicing good hygiene and good distancing and wearing masks and so forth, good personal habits. And all of that gets disrupted when things are in disarray. And that disarray can be caused by natural disasters, exacerbated by climate, as well as poverty that could be pre-existing, but increasingly is also being caused by climate change. I don't have time to give you the figures on this, but climate change currently kills very, very conservatively, at least 150,000 people around the world yearly. It's far higher than that when you include things like refugee crises caused by climate-related disasters, including the infamous massive drought in the Middle East that helped contribute to the Arab Spring and to the Syrian and Iraqi destabilization that led to the rise of ISIS, for instance, and that's caused millions of refugees, 7 million refugees, roughly, to experience horrible conditions, just simply related to that. But the list goes on. These disasters displace people. Oftentimes, they are not able to bounce back from these things. The resilience is lower, among certain populations. Okay, any questions up to now about sort of the general idea of it? All right, so let me see if this, you still can't see anything, right, I assume?
No, I can't.
Okay, sorry about that. All right, so just some of the examples. I mean, recent cyclones, and that is to say, cyclones are hurricanes if they occur in the Western Pacific and the Indian Ocean. But you know, the fact that these disasters are happening on top of COVID, as you can imagine, is a tremendous multiplier for the misery that's caused by all of this. And so we're seeing the rescuing and sheltering creating problems, as I say, the evacuation and damage to infrastructure, including you know, public health infrastructure, hospitals, public health facilities, and just first responders and so forth. But the bottom line is that those events are being magnified by climate, and not necessarily being caused originally by climate, but they're being magnified by it, and or climate change is causing significant changes to the global heat that is causing changes in overall climate as well as these acute disasters. So by 1995, more than 90% of the excess heat retained by the Earth has been absorbed by the oceans, and I'm sure most of you know that ocean heat, you know, heat particularly near the upper surfaces of the ocean, is essentially the battery power for hurricanes, for disasters like that. Warmer ocean temperatures, they make the storms more intense. They lead to more rapid intensifications, higher wind speeds, and the list goes on, right? And the other thing that happens with climate change is that it causes warmer air holds more moisture. I think most of us sort of know that intuitively who live in snowy climates. You know, it's much more likely, you're much more likely to get heavier snow when it's closer to freezing than it is when it's really, really bitterly cold. But in general, the atmosphere is holding more moisture because of the overall average warming. About every Fahrenheit degree increase holds about 4% more water, and that has essentially also led to much more deluge rainfall, to flooding, basically. And we can also see that around us in Ohio and the Northeast and wherever it is. And those disasters also stress people. They can cause destruction of food crops and obviously the stress from the disaster itself, water pollution. All of these things make COVID easier to do what it needs to do. And as I say, wildfires also a big hazard. Studies have shown that wildfires were a significant hazard at 35% of California's assisted living and long-term care facilities. I'm sure most of you know that COVID has just run, you know, like a wildfire through many of these institutional settings where people are crowded together, prisons and you know, and long-term care facilities, particularly for the elderly, and also crowded communities of color and communities of poverty in general. And so wildfires in general, water scarcity, more than 40% of the world's population is now affected by water scarcity. Water scarcity is being significantly magnified by climate change, right? So what's the problem with water scarcity? Well, obviously in the worst case, it's dying of thirst, but well before that is simply the issue that it's difficult to maintain a hygienic environment without water, right? You know, even before COVID, even before climate change was recognized, we talk in public health about water-washed diseases. That is to say, diseases that are reduced if people can have enough water and clean water to drink and to bathe and to maintain hygiene. And so the fact that water scarcity now is affecting almost half of the world's population, and that is obviously is projected to get much worse, is in addition, that alone is one of the magnifiers of things like disease, pandemics like like COVID, that are very much reliant on hygiene and the ability for people to both stay healthy because they are hydrated and also have enough food, but also just the overall hygiene. So, all right, let's see. So yeah, lack of running water for hand washing and sanitation increases the risk of contracting COVID and other diseases. On the slides that I'll send you, I'll show you that the increase in water demand that's occurred in various parts of the world for agriculture, which is almost everywhere the major part of water demand, although for countries like China, industry is actually the largest, but that's mostly an exception. So just simply for growing food, water is a significant factor, and projections are for a reducing amount of water, a diminishing amount of water, in a increasing demand for water in most places in the world. And as you can imagine, most of the places where water scarcity is a problem are also developing countries for the most part, particularly in the Middle East, but Asia and Africa and South America and Central America. By the way, one of the big causes of the refugee crisis that we've seen in the recent 5 to 6 years, which obviously the president was very eager to highlight as a disaster for migration. A big part of that was because Central America was going through a massive drought, a historic drought that has very quickly decimated most farmland, or much of the farmland in places like El Salvador, Nicaragua, southern Mexico, and so forth. And that has, in addition to other factors, has led or has been a big factor in this migration that occurred. This is very much a climate change related factor, FYI. And so let's see, more facts and figures on water. I'll give you, I'll spare you now, but closer to home, disparities in water access, for instance, have certainly heightened the cases of COVID-19 in areas, for instance, like the Navajo Nation, which had the third highest rate of COVID-19 infections in the US by May 2019, in part due to an ongoing crisis in water and water infrastructures and drought in that area where the Navajo Nation resided. And so, water, sanitation, hygiene can prevent about at least 1/10 of overall global disease, in addition to having an even more significant factor with COVID. So what else? I mentioned poverty, right? Again, go back to the Green New Deal. Loss of income from COVID has driven a recession that has at times essentially been as worse in some places, at least acutely, as the Great Depression back in the 1930s. We are currently experiencing the second worst economic disaster since the 1930s, since the Great Depression. And it has, as you can imagine, as you know, I know, because Ohio has certainly been hit as hard as anywhere in the United States. It's pushed millions of people into food insecurity and poverty, where they are being evicted from their homes, or will be after, although many people already have, but many certainly will be after the federal safeguards are lifted or eliminated. But people can't pay their overall bills, but they're having their water cut off, as you can imagine. That increases their inability to deal with COVID and just in general. And it reduces the labor supply and export markets for food crops. The United States, as most of you know, is a consumer economy. 70% of our economic activity is driven by consumers. And if consumers don't have money, then the economy is in trouble. And we currently see that. The stock market is not reflective of where the current economy stands. And again, that COVID-related poverty is bad enough, but it is being combined with these other factors, including climate-related distress in various parts of the country. Again, from the wildfires in the West Coast to droughts in the West and Midwest, and in the South, the American South, even in the Northeast, and upper Midwest, there have been droughts, but it's disrupting a lot of things, food crops and jobs and workplaces and the like, with just simply from the weather disasters, and that includes things like droughts and wildfires and floods and so forth and so on. So, the fifth IPCC Intergovernmental Panel on Climate Change in 2014 basically stated bluntly that there may be a threshold of global warming beyond which current agricultural practices can no longer support large human civilizations. That is to say, experts on climate are essentially predicting that unless things turn around, that we will essentially be increasingly looking at the possibility of mass famines and certainly increasing food insecurity around the world, in addition to water insecurity and poverty and so forth related to this. So how am I doing for time here? All right, so I'll speed this up a little bit. Let's see. So International Labor Organization predicted that pandemic-induced 6.7% decline in global working hours in the second quarter of 2020, and that's equivalent to 195 million full-time workers around the world. But increase in food prices have also come because of disruptions of supply chains, and also these disasters that are occurring that are climate related. And let's see, border closures also because of COVID have exacerbated poverty and resource scarcity, and because it's constrained exports, as I noted. The globalization of the food system is one of the successes and the vulnerabilities that we are now seeing very vividly exemplified by COVID. So climate change is a medical emergency, which is very important to note. And I'm not the only one who says this. This is noted by many people around the world. That it is already causing significant health-related and economic-related distress, and that includes in the United States, obviously. By the way, I want to note, just for anybody who thinks that this is just a problem for other people, currently the United States is experiencing some of the worst earlier effects of climate change in the world, just because of the quirks of our geography for a variety of reasons. All right, so you already know how some of the areas or ways that it affects health: extreme weather, infectious disease, vulnerability, water scarcity. Also, mental health is significantly affected by climate change as well as COVID. I'm sure I don't need to tell anybody that's on the presentation here that people's mental health is significantly strained by the outbreak currently, and that's in part obviously because of the disease itself, but also because of the economic factors on top of other issues going on in our broader society, including some in the last week. But it increases heat stress and air pollution. This is climate change, that is, and food stress, and it increases allergens as well. And allergens are associated, obviously, with respiratory distress, which is associated with greater vulnerability to all of those things, actually associated with greater vulnerability to diseases like COVID. All right, so just for what it's worth, even before COVID, worldwide air pollution kills 7 million people every year. As I noted, the studies are very solid now that show that air pollution increases people's susceptibility. One of the reasons that major cities are being hit hard, or where we're hit hard early actually in this outbreak, places like New York City, New Orleans, and others, had in part to do with the quirks of migration and travel patterns and so forth, where they were hit earlier by people with COVID coming in through those major areas, those major ports in Washington, Seattle, Los Angeles, and so forth. But in addition to that, though, cities with higher levels of air pollution have been pretty clearly shown to make people more susceptible to these kinds of things. All right, so I already talked about global heat. There's a whole bunch of stuff. I'll throw you some figures on some of the other infectious disease related effects of climate change as well, increasing the range and severity of vectors, mosquitoes, and other disease-carrying organisms. And let's see. All right. I'll show you a graph on the ambient air pollution variable. So COVID-19 related deaths, one second, in the wrong direction here. Sorry. Not exactly sure why. Give me 1 second. I gotta back out this.
If anybody has to go but would like to ask a question, feel free to type it in the chat or just unmute yourself. But we'll keep our presentation going.
Yep, and so feel free to jump in anytime. I'm almost done anyway, but I just wanted to note that COVID-19 death rates in the US are 8% higher in counties with higher than average fine particulate air pollution in places like Los Angeles, which is just getting its ass handed to it right now with COVID and tremendously high rates and hospitals overrun and so forth. And so, let's see, another figure. In 324 cities surveyed in China, found a 15 to 22% increase in COVID-19 cases in areas with elevated nitrogen dioxide and particulate pollution. This is a study done even early on in April 2022 in China. So that urban factor is definitely an issue. And this was also found, by the way, in retrospective studies of the 1918-1919 flu pandemic, where cities with high coal pollution, that was then the fuel of choice, saw 10% higher mortality rates compared to cities with low coal pollution and or rural areas. But that said, of course, as most of you know, rural areas are being hit as hard, if not harder now, somewhat delayed reaction around the country. And so I'm sure you all know this as well. Death rate for Black Americans, African Americans from COVID is more than twice that for white Americans. And that certainly may be partly due to genetic factors, but it is also absolutely partly due to poverty and the fact that African Americans tend to live more in cities on average, but also have far less access to good public health care. All right. All right. Anybody have any other questions? I think I covered most of this. Let me just make a last note here. One of the sad things about the COVID outbreak, as for climate change, is the fact that science denial has made both of these situations worse. It actually is quite astonishing the level of COVID denial and public health denial, science denial that has emerged in the last year from related to COVID. I think most of us are shocked at how bad it's been. Some of that obviously has emanated from the White House, a good percentage of it, of course. But both of those are science-related issues where public misunderstanding and or denial of the science has made the situation much worse, both for climate and for COVID. And if anybody's interested, I'd be happy to tell you the ways in which that is true. All right. Yeah, I've got a whole bunch of figures about COVID susceptibility related to people of color and indigenous people and air pollution in general. And I'll send those along to you. And also poverty related issues as well. But also, by the way, one of the things that air pollution does, fossil fuel particulate air pollution does, is it damages hearts and brains of people living in polluted areas, and that particulate pollution has been shown to be correlated strongly, not just with respiratory effects, but also with increasingly it's turning out to be people who have damage to their hearts and neurological damage. One of the scary things about COVID that's increasingly emerging is that a significant minority of people are having long-term and in cases in some cases, maybe permanent damage to their cognitive abilities, to their ability to think, reason, and the like. And that is as troubling as anything for the survivors. All right. And I'll shoot you some slides on susceptibility to different pollutants and all the rest of that, and how it's correlated with hospital visits and respiratory issues and the like. Anybody have any questions at all about climate change and COVID in general, even if it's just something that you're curious about that is related to any one of those issues? Alpha Blue Chip going to be teaching about in the spring.
Real quick before we go to questions, I just wanted to mention that Dr. O'Sullivan did our Voting for Sustainability event with us, and we talked a lot about the Green New Deal. That is up on our YouTube channel if anyone's interested in learning more about that. And then Dr. O'Sullivan, thank you so much for speaking today. I appreciate you working through all the technical difficulties with us. And
I'm sorry I didn't preview this earlier.
No, so, that's okay.
Next time.
And then if you want to email those slides to our ESW Akron at Gmail, we'll make sure to disperse those to our members.
Yeah, so. We'll do, absolutely. So no, if you guys got to run, no worries. I totally understand. But for what it's worth, Aaron has my, and Mikhail both have my email. And I'd be happy to entertain any questions if anybody's doing something related to this to lead you in the right direction. If you wanted help on a paper or just are personally interested in, don't hesitate to contact me. Okay. So any last questions about any of it?
Yeah, I have a question. So every time I talk to basically anyone and they're talking about climate change, it just seems like it affects every part of our lives, but it's something that doesn't get discussed, or at least doesn't get discussed with people who are very educated. And I'm just wondering where you think the disconnect comes in.
This is a very complex issue. I could spend 2 hours or more answering this question, even at an elemental level. The bottom line, though, is it's a great question. It is in many ways the question. I want to first emphasize it's not just uneducated people, because there is a strong ideological factor that has developed over the last 20 years. Back 20 years ago, it's important to note that both major parties accepted the reality of climate change. And so this climate denial is really only within the last generation a Republican thing, right? And it's a sad commentary in a lot of ways, but it's also important to note that it's not just the Republicans. This is also Democrats. Both major parties have politicians who have taken substantial amounts of fossil fuels and utility money. All of you in Ohio know what utilities have done. That $1 billion corruption scandal in Columbus is just appalling. And I was there while it was going on, and I couldn't believe how brazen it was. But so political influence has essentially made the dialogue increasingly either anti-climate science, or in the case of sort of more corporatist, more establishment Democrats, to sort of ignore it. Some of the appalling figures that I don't have time to give you, but in a nutshell, are that most major legacy media does not still to this day cover climate change to any significant degree. And one of the reasons is that they're afraid to stir the pot politically, is one of them. And the other reason is that they are afraid to say anything controversial. And so even when they do cover it, they'll do this false equivalence, right? So they'll have somebody who's a pro climate change and somebody who's anti climate science, and sort of present that as though that is the debate. That's not the debate. In fact, the debate is between science that says that we're in trouble with climate change, and science and positions that say we're in really big trouble with climate change. The denial is simply nonsense. It's fake news. It's It's anti-science. It is not supported by the facts. Climate change is real. Global warming is real. All of it is. But in our society, money has corrupted the debate, and to the point, as I say, of either misinformation or a lack of information. And so, to go back to your question, it's not just ignorance. There are lots of people who are educated who just don't realize how bad the issue is because they don't see it in the news, just as you know that you don't see it in the news. And if you look at polling of Americans, they think at least within the last 5 years, national polling essentially, if people are asked the question, do climate scientists agree that climate change is a significant problem? Most people in the United States, something like 55%, or most people think that it's 50-50, that half of the climate scientists don't think it's a big problem and half do. Whereas that's absolutely not true, of course. It's 99.99% of climate scientists who know that it's a major problem, and then it's just a debate about which ones think it's catastrophic in the short term, and which ones think that we've got a little time, before the catastrophe hits. Does that sort of address your question?
Yeah, thank you.
Yeah, no, absolutely. And it's a psychological thing too, by the way. No matter how educated you are, and I include myself, we are all also susceptible to this immediacy bias, as it's called in the literature. That is to say, we react to things that are in front of our face or that we've experienced. And so if it's not in front of our face, if it's something that's sort of out into the future, or it's not something that we've ever experienced, and that includes obviously one of the ways that people can deny COVID is because they haven't experienced it before, so they just sort of convince themselves that it's not happening. But that also applies to climate change and to the fact that American society discusses climate less than any other Western country in the world. It's appalling. Anyone else? Or if you had a follow-up.
Are there any other questions on the team side? Because if not, I have a few questions, but you guys can go first. Okay.
Sounds like it's you, McKenna.
Type your question if you don't want to turn on your mic.
So I have a question regarding, I've seen a lot of things floating around on the internet that like with global warming and the ice caps melting, that we are going to be experiencing more and more of these viruses, that have been quote unquote extinct for millions of years, that we are not going to have the capabilities to combat them. I guess just what is your take on like the validity of that statement? And
yeah, that's a good question. And there has been a lot of speculation about that. At this stage, I don't think it doesn't seem to be clear that we're in immediate danger from the outbreak of something that's been frozen in the Antarctic, that kind of a virus. That is a concern. There's no question about it. But far more of an immediate threat is viruses actually that are at the other part of the globe, at the equator, and many of the most virulent, badass diseases that exist out there are tropical diseases like and yellow fever and Ebola and a variety of hemorrhagic fevers, chikungunya, and the list goes on and on. And the problem with global warming, because that's what's the essential element is that it's increasing the range of the vectors that carry those things. And one of the most, or I should say, the most deadly animal in the world is the mosquito, because mosquitoes carry all of those diseases that I just mentioned. And so we're far more threatened by diseases that are moving north and south away from the equator, and are going to and have already made the southern part of the United States more susceptible to mosquito-borne diseases and other similar vector-type-borne diseases. But there absolutely is concern about things that could just sort of pop up a la science fiction from the melting tundra and Antarctic ice. So I'd say it's absolutely a valid concern, even though at the moment it's less of a concern than these other things.
Okay.
Who else had somebody had one that they were going to ask. Nope. Didn't somebody say that they were going to mute their microphone or something like that? Or was that you, McCallum?
I think that was just Megan letting people know that they could type it in the chat.
Gotcha. So you had another one, you said?
Yes, I do. I have lots of questions, but I just have one more as of right now.
That's good.
So this is another thing that, has kind of been thrown around. Do you think that COVID was in the United States like long before, it was quote unquote in the United States? Because I, just personally, like I know that my one friend, like it was actually on Valentine's Day, like we had to take him to the emergency room because he was coughing so hard he could not breathe. And like, they said, oh, it's flu type A, but and like I heard of a lot of people that were super sick, January, February timeframe, and they diagnosed it as flu type A, but
right. Did they actually do tests? Do you know?
I'm not aware of that. I just know that it seems like they had all of the symptoms of COVID, but COVID wasn't an issue then.
So assuming they didn't actually do a flu test, which tends to happen in flu season if somebody goes into a hospital. So they may have done flu and confirmed it, but if they didn't, your observation is absolutely correct. There's no doubt that COVID was already infiltrating, possibly as early as December, and certainly into January and February. Interestingly, my brother, who also remained undiagnosed, got what was almost certainly COVID in late February because he worked in an office in Boston with a bunch of people from China and a biotech startup, and those people were moving, not just those people, but people in his company were traveling back and forth to China, and there were others in his office who were diagnosed with COVID. So he interestingly enough, much to his and our dismay, is experiencing some of these long hauler syndromes. He's having respiratory issues still, since February, almost a year now, where he can't, he was a triathlete and he can't do intense aerobic exercises because of his lung limitations. And they're basically telling him, wait and see, hopefully it'll resolve over time, but it is quite possible that his lungs are permanently scarred by his early bout of what almost certainly was COVID. So yes, it was around and circulating. This is one of the problems, to sort of jump off your question, McCall, that we hear about the UK, United Kingdom variations that are 70% more contagious than the previous one. And South Africa, and now Japan also has a version that's more contagious. And so we've essentially either cut off airline travel or said people have to get a negative test within a certain amount of time. But almost certainly the barn door is already open, and many parts of the United States are undoubtedly currently having these new strains emerge, which is going to complicate the hell out of things before we get the population vaccinated, because we already obviously we're having a surge on a surge from Thanksgiving and then Christmas and then New Year's, from people traveling and circulating and so forth. So we're not out of the water yet, even though we can see hopefully light at the end of the tunnel. Does that sort of answer that more or less?
Yeah, thank you.
Yeah, no, absolutely. Yeah, no, the public health people are constantly driving home the notion that once it becomes sort of, once we see it on the radar, once we have cases that emerge, that there's almost certainly, either the tip of the iceberg that we haven't seen, or just simply that it's been percolating at low levels before it made its breakout. And that's absolutely been shown to be the case by retrospective DNA or RNA, genetic analysis and so forth. That's shown that was true. Another question, or you want to leave it at that? What do you guys think?
I will take silence as there are no more questions. Thank you so much, Dr. O'Sullivan. I always enjoy listening to you speak. So
my pleasure. I'd be happy to come again, and hopefully next time we'll enable you to see some of my cool slides.
Okay.
All
Thank
right, so-
you.
Yes,
Yeah,
thank
good.
you.
my pleasure.
Thanks. Have a good day.
You too. See you soon. Keep safe.
All right. Goodbye, Dr. O'Sullivan.
Take care.
Okay. Stop sharing. Okay. Oh, alrighty. Okay, cool. We got those out. And then we can also include those links in a little follow-up email.
Yeah.
When he sends the slides, we'll just put it all out together.
Well, that concludes our meeting. If you'd like to stick around and chat, we can, but that's the end. So thank you for joining us for our first general body meeting.